In this video, we will talk about a shifted approach in our work with kids who learn differently. As a team, we feel that this video is one of the most important videos that we will create. Our goal is to help you make this shift in your work with students with FASD or any student who has learning and behavioral difficulties. We want you to shift your thinking away from your student as being the problem in your class to your student as having a difficulty. In other words, shifting your focus away from the perceived willful behaviors to a focus on the behaviors as being symptoms of a brain disability. Remember that the prenatal exposure to alcohol may have caused a brain injury. For the developing fetus, the presence of alcohol can affect the structure and function of the brain, so we need to view this student as having a physical, brain-based disability. If we view the student as having a physical disability, it changes the way we view the student and it changes the nature of the interventions. A great analogy is to imagine that a student who is confined to a wheelchair is assigned to our classroom. We immediately begin to make appropriate accommodations to support this disability. For a student with an obvious physical disability, it is easy to focus on making accommodations. The challenges for educators is understanding that the majority of our students do not show any of the physical characteristics associated with FASD. For a student with FASD who may appear normal, it is far too easy to focus on the behaviors and not acknowledge the disability of the brain. According to Claren, Astley, Streisguth, and many others, our students with FASD are most at risk for failure. By acknowledging the student's brain dysfunction as a physical disability, we start to think about providing accommodations that will allow our students to experience success. If we can shift our thinking away from the behaviors and focus on supporting the disability, as with the student in the wheelchair, the accommodations become more obvious and effective. When we support the disability, we reduce the student's frustration, which in turn reduces the behaviors. This is the approach we encourage all educators to adopt. For myself, teaching for 15 years in an inner-city school has given me the experience of working with many students who display the characteristics of FASD. Through trial and error, I learned which accommodations worked and which ones did not. Prior to knowing anything about FASD, my students taught me that I needed to use activities and teaching techniques that were suitable for younger students, that the activities needed to be designed to allow for student success, that I needed to provide extra supports like visuals and supervision, that a consistent, structured classroom was best, and that knowing my students well allowed me to plan in a way to avoid potential problems. During one of my last years at this school, I came across Diane Malbin's work and immediately began making all of these connections as to why my classroom in this challenging setting functioned well. I was making accommodations for what my students had trouble with, and I found that doing so reduced my frustration and theirs. I was providing an environment where the students could be successful. Although the information helped to validate my effective practice, it also made me feel a sense of guilt, as I instantly remembered some of my past students where the focus was on changing behaviors rather than on supporting their brain disability. Increasing our understanding of FASD is key to making this shift in our approach. When we view our students with learning and behavior challenges as having a possible physical disability, we immediately begin to look for ways to accommodate the student's deficits. We need to look beyond the behaviors and look for underlying causes for those behaviors. In Diane Malbin's famous words, we need to try differently rather than harder.